All right. All right. So thank you for everybody for being here today. This is my third presentation now. I'm fortunate to be able to present to you guys again. Today, we're going to be focusing on immune support strategies. And if you guys missed my last two presentations, the one on CBD was recorded. I should probably ask right now, Julie, can you record this one?
Yeah, it's recorded.
Oh, excellent. And this will be recorded as well. So without further ado, let's get started. So just a little bit about me in case you guys don't know me and why I'm talking about the immune system and looking at pharmaceuticals, nutraceuticals, and lifestyle today. So I'm a doctor of pharmacy. I own Sawyer Street Hometown Pharmacy here in town. So if you guys ever have any questions or need anything, always feel free to give us a call or stop in. Happy to help any way we can. I'm also a certified sports nutritionist. So being a doctor of pharmacy, we're kind of the experts in our microbiology and how our cells function, how medications, how nutrients, how lifestyle affects cells. And what my main goal is leveraging other strategies besides just medications to improve overall health, and nutrition is a big portion of that. I do nutrition consultations for everyone from athletes to someone just looking to be healthier. And we also started a wellness company called Evolve Wellness, and this is really just around consultation. We do make a few dietary supplements that we make ourselves, so we see the process from start to finish, and we are making just ones that we know we can make more cost effective for people. So I kind of have a broad background. I try to immerse myself with people who think differently than me, so I can get kind of push back on my echo chamber in the conventional healthcare system. And because of that, kind of known as, and a lot of our pharmacists actually at Hometown Pharmacy are known as pharmacists that doesn't like drugs or pharmacists that don't like drugs. And really what that means is we realize that medications are great tools, but in the traditional healthcare system, we really jump to them too quickly. We look at disease state X or symptom X, and we look at which medication will decrease that symptom, when in reality, all of the medications, when you look at the studies, they're paired with lifestyle modifications and paired with looking at optimizing foundational health first. So yes, medications are great tools, but they're definitely overutilized right now, and something that we work with our patients to have them on what we call the lowest effective dose and then the lowest amount of medications necessary. But yes, medications are a great tool. So in the presentation today, I'm going to be focusing on the immune system in general, and because of the situation we're in right now with the pandemic, would love to be in the room with everybody right now, and hopefully we can do that safely soon. But a lot of the topics I'm going to discuss about are going to be specifically related to COVID-19. I just want to make a couple points before we get started. If you have COVID-19, or if you suspect you have COVID-19, or if you test positive for COVID-19, or if you're in contact with someone with COVID-19, get in touch with your healthcare team as soon as possible. In certain circumstances, there may be therapies that may decrease disease severity and duration. So basically, don't do what a general man does, kind of like myself or most men in general. I think there's this thing when you get sick or hurt, oh, we're fine, we'll be okay. But in reality, what happens is when someone gets sick, the medications that are now approved with monoclonal antibodies and other things you can get at the doctor's office that will help prevent the severe outcomes that might be coming down the road need to be taken right away. So for the best outcomes, that's why it's really important, if you do get diagnosed with COVID-19 or you suspect you have it, to talk with your pharmacist, talk with your doctor, to making sure that the strategies you're taking are the most appropriate. A second thing I want to mention, I'm going to be talking about a lot of lifestyle modifications, talking about a lot of nutrients that we know from an overall health perspective are important, but I want to make sure we don't make any jumps, and there's no known cure for COVID-19. All these considerations are meant to attempt to balance physiology to decrease severity of disease. So we're going to be looking at some things, and specifically looking at the research with the immune system and COVID-19, but most of these things in general can be taken a lot across broad health categories. But just know, if anybody tells you that there is some supplement or something that will cure COVID-19, there's nothing right now. We know there's EUAs for certain things that are helpful, but nothing is a magic bullet. And these are the things we're going to be talking about today. I don't want to spend too much time here. Let's see, they're all number one. But just if you want to go back and look at the slide, these are the things I'm going to be focusing on today. And I think the most important thing as we go, my goal of this presentation is to talk about modifiable risk factors. I think we all know in the news, and we see studies coming out very important on non-modifiable risk factors impacting severity and morbidity and mortality to COVID-19 and other infections. So these are things like genetics. We even hear about blood type. You hear about age. So these are all things that are outside of our control and that we can't change. So these are all interesting to look at and important to look at, specifically when we're deciding who gets vaccine and what order. But I think a more important conversation to have for everybody, there's certain lifestyle strategies we can take. There's certain things that we can do that are within our own locus of control that can improve not only our immune system, but improve our health overall. So I wanted to start with this quote from one of my favorite Stoic philosophers, Epictetus. Just keep in mind, the more we value things outside of our control, the less control we have. And I think for me with social media, luckily I don't have many things I try not to go on. There's a lot of things that are happening there that get myself and everybody else riled up. And there are certain things that we can do something about, certain things we can't, and just realize the difference between the two is very, very important. So we're specifically talking about COVID-19. Oh, and if you guys have questions, feel free to put them in the chat. I'll try to stop probably about halfway through at 10:30 just to see if there's anything in there. And if not, I'll keep going. We've got until 11:30 today. I do have, I have at least 2 hours of content, but I'll try to address questions because I'll get through the most important things first. So I see my numbers aren't showing up correct. I apologize for that. But when we look at the four big items, no matter if I'm looking at it from a functional perspective or a traditional medicine perspective, the four things we look at are: number one, preemptive mitigation of viral exposure; number two, addressing comorbidities, which is I see as number one; also number one, address physiological dysfunctions; and then address immunity. So these are basically just a bunch of big words that I'll put into actionable lifestyle strategies. We're going to start with the preemptive mitigation of viral exposure. This is something the healthcare system has done a great job of telling people to do, and unfortunately there's some pushback on it, which doesn't make sense, but I'm not going to spend too much time on it. So to decrease your risk of exposure and to decrease viral load, the two big things we keep hearing about, and yes, they are important, are physical distancing and masks. And I like the term physical distancing much better than social distancing because we're interacting right now together. I can feel some energy here, which is great, but just know that these things are very important, and I'm not going to spend a lot of time on these things because it's something that's being talked about a lot. But yes, these two are very important for decreasing virus exposure and viral load. And the second thing that's being talked about right now a lot, and I want to make sure I don't mince words here, is the immunizations are very, very important to get. So when you're eligible, definitely get the vaccinations. I'm fortunate being a healthcare provider giving vaccines. I was able to get my first dose 3 weeks ago. I'll be getting my second dose tomorrow, this Friday. But the most kind of targeted, when we look at the most targeted thing we can do specifically for COVID-19 is the vaccination. So yes, it's very important to get the vaccination, and there's a lot of talk between the two available right now between Moderna and Pfizer. Quite frankly, if you look at the overall data, they're about the same. They're both mRNA vaccines. They're just packaged a little bit differently. If we look at the efficacy in the trials, about the same. We look at the side effects, about the same. I know you hear different news reports on one versus the other, but And what I'm going to tell you guys today is what I tell my family, and I think that's what's important as healthcare professionals, just to have this transparency. I'm not going to tell you guys something that I wouldn't tell my grandma, I wouldn't tell my mom, I wouldn't do myself. So no matter which vaccine's available, and the two available right now, Pfizer or Moderna, for me, I would get whichever one that you're able to get, and don't worry about making the decision between the two. All right, I'm not going to spend too much more time there, but immunization is very important. There's another meeting coming up the end of February to have another EUA for a third vaccine and possibly a fourth that are going to be single dose. But for the two we have available right now, the efficacies and the side effect profiles are about the same. So no matter which one you're able to get, when you're able to get it, I encourage everybody to get the vaccine. So with that being put aside, so we want to look at now what we can do for ourselves and kind of what my consultation services are all about, how we can improve our own function of our body, how we can improve our own innate immune system. But I like this quote. So the likelihood of severe infection, and this is specifically talking about COVID-19, and you could extrapolate this to any infection, it's the balance between viral load and host immunity. I shouldn't say this for any infection. For some infections, the viral load doesn't seem to matter that much, but for COVID-19, if you guys seen the reports in the hospitals and nurses that are exposed to a large viral load, even though that they are quote unquote healthier, because it's a large viral load, they have a harder time dealing with it. So we talked about decreasing the viral load when we talk about the physical distancing, we talk about masks, we talk about even ventilation, air systems, and being outside. Unfortunately, it's very cold right now. So we want to decrease that. But then I think the thing that kind of frustrates me that the healthcare system has done a very poor job about, and again, I realize there's a lot of non-modifiable risk factors here, but looking at host immunity and looking at lifestyle and looking at not only lifestyle, but looking at certain nutrients and dietary supplements where there is evidence for. So what I'm going to be focusing on now is looking at how we can help improve our immune systems and our immune response, no matter where we're at. All right, so this is a slide that I bring up a lot because no matter if I'm talking about the immune system, cardiovascular system, digestive system, the places we start when I'm doing wellness consultations is always the same. We start with lifestyle. So the immune system is no different, and I'll show studies specifically looking at these 4 core principles that we have with nutrition, with movement, with sleep, and with stress management. And stress is neither good nor bad. That's why I don't like to say stress reduction, because acute stressors, as you guys will see with certain types of exercise, and certain other types of acute stressors like even heat and cold. So I'm fortunate to have a sauna in my backyard. I was just in the sauna this morning. Those type of stressors, acute stressors on the body, are important. And then we look at other measurements. These are measurements we do in the pharmacy with the biophotonic scanner, vitamin D levels, in-body analysis. And these are things we're just actually getting started. So if I haven't talked to you about this before and you're a long-term patient of mine, that's because we're just getting them in, which has been very cool to look at. But then we look at foundational nutrients. And I think an important thing here is why 1 through 4 is lifestyle, no matter what disease states we're looking at, is that's where we want to start. And that's where most of the improvements in the immune system, digestive system are going to be, are changing areas here. And again, it doesn't matter where you're at, it's just, can we look for specific areas to improve on, and that's going to improve on our overall health. Then we look at foundational nutrients and targeted nutrients. I think a common misconception with dietary supplements is we all think about them as with vitamins, minerals, other nutrients, herbs even, that the first way we can think about them is filling in gaps. So I do, with a lot of my clients, we'll do a food log where we look at what foods people ate, and people are pretty consistent on the foods they ate, and then we'll fill in gaps. And we first look to fill in gaps with whole foods, but that's not always the case. So then we look at using dietary supplements to fill in gaps. The big ones that people are missing are vitamin D that usually come up, magnesium, vitamin K2, and omega-3s. But each person's different, and we always look for nutrition first. But that's the first way to use dietary supplements. The second way to use dietary supplements is targeted nutrients. So for me, I have pre-hypertension. I have a family history of cardiovascular disease, and my blood pressure is right on the borderline. So again, as the pharmacist that doesn't like drugs, my goal is to always, what can I do, lifestyle first, and then looking at these things to help that. So for me, I take pretty high doses of magnesium glycinate and beetroot powder. And these are things that I try to get from my diet, but because of the quantity I have to take, they're actually more like, I use them more like medications. But a lot of these nutrients are able to use at higher doses, and they have a lower risk of side effects. And I could eat a whole mess of beets every day, but getting in a powder is just a lot more convenient. And those are two things that can be very helpful for blood pressure. So just know when I'm talking about nutrients, supplements, and even prescription medications here, that each person is different. Just because I take really high doses of magnesium glycinate and pretty high dose and high quantities of beet powder doesn't mean that you should. But this is kind of what's going through my mind whenever I'm talking to somebody about a specific disease state, no matter what it is. And again, we're focusing on the immune system, but this is what we look at first. And then you see 7 is prescription medications. And yes, they are great tools. We want to see if we can use these other principles first. So let's get back to the immune system. I think a really cool thing that happened actually in March was the Wisconsin Department of Health Services came out with Resilient Wisconsin. And they came out with these things that are going to be helpful beyond just the masks and social distancing. But they haven't talked about it much since then. So I really want to go into why these things are important. So they listed the 3 goods, and that's good for you foods, a good night's sleep, and a good amount of exercise every day. So we all know those are good things to do, but I'm going to talk about some specific things that we can do to improve each of those categories and why they're particularly impactful on the immune system for the situation we're in right now. And they also talked about other things that are very important as well when we talk about staying connected to our support systems. So even though we're not in person right now, we're connecting virtually, spending time away focusing COVID-19. So we're focusing on it right now, but hopefully the rest of the day you'll be able to do some things away from focusing on COVID-19 and or anything else that's happening on Facebook, because it's probably not good. And then we talk about reducing anxiety by reducing risk. So this is when we talk about the mitigation strategies. And I haven't talked about hand hygiene, but I think you guys all know that hand hygiene and social distancing. And then checking in with ourselves. It has been very stressful, not only on me, but I know just not being able to see family has been very difficult. So just making sure that you have time for yourselves and trying to connect with people that is as safe as possible. These are all very, very important things to do, but we're going to focus on those 3, the 3 goods right here, because that we can make some simple changes that'll have some big impacts. An important thing when I'm talking about the 3 goods is to remember we're all at different points here. So to strive for progress, not perfection. If I tell you guys something that going for a walk is good, it doesn't mean you need to go for a 100-mile walk, and particularly outside right now. It's pretty cold, so it might just mean vacuuming and just moving around. So just know wherever you're at, there's ways we can improve these areas. So we're going to focus on the good for you foods first. I think some of you guys have probably seen this slide from me, but in the United States right now, this is just something extremely important that we all focus on. And I think we've done a poor job of focusing on this. We look at eating nutrient-dense food and shopping the grocery store outside in. So eating the foods that my grandma would recognize as foods is super, super important. And we look at in the U.S., this is from 2014. I should probably get a newer one, but I bet it's gotten worse. The most commonly eat vegetables are potatoes, tomatoes, onions, lettuce, sweet corn, carrots, and romaine lettuce. So these are all good and fine, but the problem is the form that we're getting them in. And I think you guys can kind of guess where this is going. We're eating the most vegetables as potatoes and tomatoes, and I think the form we're eating them in. So God made these great potatoes and tomatoes, and we make French fries and ketchup. So it's something that we're turning these great nutrient dense whole foods into some of this. And don't get me wrong, I enjoy French fries and ketchup just as much as other people do, but just realize our quality of what we're putting in our bodies has gone down significantly. So it doesn't mean you need to cut this out altogether. Again, I like French fries, but it might mean that working with your nutritionist or working with a healthcare professional and just adding an easy thing I have patients do is before dinner, I don't like to eliminate a food. If our goal is weight loss, I say let's add a salad before you eat. So before every meal, someone adds a vegetable to that meal, and that is something that can be very helpful. And again, each person is different. I have people whose goal is increasing muscle mass or increasing bone density, and they actually need more calories. So just know there's a lot of nuance here, but in general, everybody can work on adding more fruits and vegetables. And I'll talk about why these nutrients are really important. And if you do stop in the pharmacy, we've got this great handout called What Do We Eat? That instead of me going through your diet, you can just kind of look through this handout and see what areas you might be missing. And then it gives you ideas of foods to add in to fill in some gaps. So the reason why, one second. Oh, there we go. Cool. And I'll just touch on this slide just briefly. I think by this time, it's been about a year since we've all been getting things from physical distancing, but just know there's a lot of options to get good, healthy food from physical distance, from the grocery store, from services like Instacart, and even some of our local grocery stores like Wagner Market has options available for curbside pickup and concierge service where there is opportunities to get these fresh whole foods without going in. So the only option is not pizza or chicken wings. But I know if you look at the sales last year, comfort food, that's what's been going up. So just know there are ways to get healthy foods as well. And not only that, at your pharmacy, wherever you're at, there's ways to get what you need without going into the pharmacy if possible, if they've got a delivery service or curbside pickup. But why these nutrients are so important when we look at deficiencies, because we're not getting the fruit and vegetable intake that we used to, and quite frankly, most of these fruits and vegetables don't have the micronutrients that they used to. Eating more whole foods will ensure that we're getting enough micronutrients. And if we look at the immune system, so diet alone may be insufficient, and a tailored micronutrient supplementation based on specific age-related may be necessary. So basically what this paper talks about in the article Nutrients is looking at immune function and micronutrient requirements. And it does change over life course. So just because my niece might need X amount of nutrient, I might need a little bit more. And again, first looking at diet, but the big ones that come up quite frequently, and I have them highlighted, are vitamin D and iron. And iron is in particularly certain females and people who don't eat a lot of red meat, so not the standard American diet, but something that can cause a lot of issues if you're iron deficient. And the good news is there's blood tests for both of these, so you can see where they're at. And then we talk about zinc a lot for the immune system, and we're just not getting zinc from our diet. So just you don't need to go overboard on this, but a good quality multivitamin can help fill in some of those gaps. And again, realizing that starting with food first is super important. And then the second thing we talk about is a good night's sleep. So we have a good amount of nutrition, then we have a good night's sleep. And I'll talk about why this isn't so important, but a lot of people with the pandemic, because we're on our computer, we're not moving as much, we're not doing certain things, have had issues with sleep. And the two most impactful things that I've noticed for my clients and my patients that can improve your sleep and improve what's called your circadian rhythm, if you're having issues sleeping, is one, and it sounds counterintuitive, but is morning sun exposure. So this morning it was a great sunrise. And again, unfortunately, it's very cold right now, so this is much harder to do right now than it was in the summer. This is a picture that I took this summer by Menominee Park, and is much easier to go for a walk in the morning then than it is now. But just making it a point to see the sun at some point within 2 hours of you getting up. The best would be to go for a walk. And again, we don't have to stare at the sun, but without sunglasses, and that just helps to set the circadian rhythm. Your body says, okay, it's daytime. And then at night, the opposite is true. So you see me here with these goofy glasses on, and it's not necessarily that you need these glasses, but at night, how our body primes ourselves and tells ourselves it's bedtime is by decreasing blue light. So in the past, we didn't have all these overhead lights. We would be outside. The only lights we would have is the stars, which with light pollution, we can't see very much anymore, and the campfires. So that kind of tells our body that, okay, it's time to wind down, it's time to go to bed. So the second most impactful thing that we can do to improve circadian rhythm or sleep is to decrease blue light exposure at night. It can be as simple as getting something like these glasses. They're like $20. Or if you don't want to look like that, there's programs that you can get on your computer. Because the problem I have is I do email too late, and then that gets but there's a program everyone can download on their computer called Flux. If you're using your computer late, it's a free program that will decrease the amount of blue light based on the time of day. So you don't have to do anything after it installs. It'll just take out the blue light as the day goes on. But it's something that's, it doesn't seem like it would be as helpful it is, but it's super helpful, and it does take about a week or two for your body to reprime, but it's helpful for setting that circadian rhythm from these light cues. So sunlight in the morning, and then when the sun goes down, we really should be decreasing that blue light. Another free app that's very useful is an app called Headspace. So the other most important thing that we've seen to help people kind of fall asleep is some sort of meditation practice or some sort of mindfulness practice. So for me, my insomnia is usually related to I'm just thinking about what's been happening throughout the whole day, and my mind's kind of just racing. So Headspace is an app for guided meditation. It's a free app, but whatever mindfulness practice is helpful for you to kind of disconnect from the day can be very, very helpful for falling asleep. And then, unfortunately, with the access to some of the gyms right now, it's a lot of people, including myself. Haven't gone to the gym in over 10 months now, which is crazy for me. I used to go to the gym 6 days a week, but I found other ways to get movement in, and there's through different resources in town, the YMCA Senior Center, and they're doing a great job of doing safe in-person things as well. So just things to consider as their options if you're comfortable they're working at home or going to the YMCA. But these things can be very helpful as well, and preferentially for sleep. Working out sometime towards the beginning of the day is very, very helpful. So these are all things you can do to improve the quality of sleep, but we're going to talk about next why the quality of sleep matters for our immune system and why it's probably one of the most important things that we can do for our immune system. And if you're looking for it's kind of a funny book too, but my buddy, Dr. Mike T. Nelson, he's a PhD in exercise physiology, and he's a guy who studies a lot about sleep. It reads as a children's book, but it has a lot of great tips for good sleep hygiene. And we have these at the pharmacy for sale. I think you can get them online too. And another great book, if you guys are interested in learning more about sleep and some more specific strategies, is Dr. Matthew Walker. He has a book called Why We Sleep. He's one of the leading researchers in the world on sleep. It's just a fascinating book. And I love one of his quotes: "Sleep is the single most effective thing we can do to reset our brain and body health each day." And he says body health. I think he's British. He has some weird words, but it's a great book. But so why improving sleep is important is we look at, this is from the CDC, and I think it's a it's a nurse's course. My wife used to be a overnight nurse. She's now a nurse practitioner So she's not working nights, but sleep loss has a major impact on the immune system and getting sick. So just know if we're not getting the sleep that we need, our natural killer cells will decrease, so we increase the risk for viral infection. Our antibody production decreases, we increase the risk for common infection. So sleep is specifically important for the immune system and basically every function of the body. One thing too that I think just people think is kind of cool that I usually bring up with this is when you get a vaccine, you're also producing antibodies. So theoretically, the better sleep you can get around the time you get your vaccine, the more protective it will be. So it's something that I usually recommend people take melatonin around the time they're getting their vaccine. Theoretically, you might be able to have a little bit more antibody production and a better immune response to the vaccine. But just know, if you're having trouble with sleep, talk with your pharmacist, talk with your doctor. There's a lot of strategies that we can do outside of just medications. And the fortunate thing is a lot of the medications is they improve sleep quantity, so the amount of time you're asleep, but they decrease sleep quality. So even though you're sleeping longer with, say, a Ambien or maybe a benzodiazepine or Benadryl or NyQuil, all of these things are okay tools, but they really should be used on an as-needed basis. So if you're using those things, talk to the pharmacist about ways we can decrease the use. But yes, sleep has a major impact on our immune system, and we all can improve with sleep, but each person is very different on the way to improve. And I do want to talk about melatonin, because if someone's looking for a capsule or a tablet to use to help them sleep, my first go-to is always melatonin, and usually melatonin combined with some magnesium and L-theanine. These three you can use a little bit. If you use them together, you can use lower doses, so there's some synergy there. And again, the lower the dose, the better. But melatonin is something that at the beginning of the pandemic was a theory on why young kids were so resilient and resistant to that. But there's so much going on with kids. It's definitely not just they have better melatonin production than, say, myself or as we get older. But melatonin is a hormone, and it does decrease as we get older. And the best way that we can increase our own melatonin production is to see blue light in the morning and then decrease blue light at bedtime. But it's something that's a very safe supplement used in low doses. So if you're looking for a supplement that might help with your sleep quality, it's something I recommend quite a bit right now. Using a melatonin supplement before jumping to medication like Ambien or NyQuil or ZQuil is something that can be very, very impactful. And even if melatonin isn't helping, you don't feel like it's helping your sleep, a low dose is probably still something that will be helpful if you're fighting off a viral infection. So it's something that I recommend to my patients who are who've been diagnosed with COVID-19 or other infections, is even if they're sleeping all right, taking melatonin, because it acts as an antioxidant and is very safe, it theoretically can be very helpful. So first, for sleep, if you're going to reach for something, look at melatonin, magnesium, and L-theanine. Then, so first talking about nutrition, talking about sleep and why those are important and some specific strategies to improve those. The third one we're going to talk about is a good amount of exercise, and this is where we talk about a stress being a good thing. So even if exercise may just be vacuuming. So just vacuuming, moving around is much better than me sitting all day on my couch watching Harry Potter on Netflix. So no matter where you're at, if you're at, this is a picture from the senior center with Alec working with some of his clients to exercise. No matter if you're going to work out in a safe space or just walking around your home, wherever you're at right now, we always can improve the amount of movement that we're getting each day. So it doesn't mean if you haven't, so like for me, I'm not a great runner. I run a couple miles, but I have friends who run marathons. If I ran a marathon, that would be terrible for me, but a couple of my friends can do it. So we look at exercise as what's called a hormetic stress. So for me, if I ran a marathon, if you see this graph over here, I would be in this quote unquote toxic dose. That'd be too much stress in my body, just is not helpful. So what we're looking for, and most people don't need to worry about this, but I have a couple overzealous clients that I work with that sometimes overdo it. But we're looking at the hormetic region or beneficial dose of stress. So just like some people can shovel their driveways and be fine, some people shovel their driveways and have heart attacks. The reason that is, that's the highest stress that they've put on themselves probably that whole year. So an important thing just to build up this stress response is to do some sort of movement intermittently throughout the year, so these things don't happen. Again, working with an athletic trainer, working with, if you're unsure on what amount of stress on exercise is good for you to stay in this region, working with someone at the YMCA Senior Center, lots of great places in town, is important. But when we look at the immune system, just like nutrition and sleep is important, exercise is no different. So we look at the repeated exposure to a single stress stimulus, such as exercise, improves stress resistance and immunity, rejuvenates mitochondria, and then it increases the organelle functional reserve. So basically what this is saying, most people exercise just to lose weight, which this is good. So to improve body composition, to lose fat mass and improve muscle mass is great. But even if we're moving and maybe we're not losing weight, it's still going to be helpful for ourselves. So we don't just need to think of exercise as something that only people do that are athletes or people do that are looking to change how they look. And yes, people like to do this, is important, but more important to me is no matter if we see changes in the body or not, just this consistent stress, which is called hormesis, makes us more anti-fragile. And basically what that means is you put a little stress on a system, you actually improve the stress tolerance of the system. And if you guys are looking for a great book to read, one of my favorite authors, Nassim Taleb, he's a guy who thinks much differently from me, but he has a book called Anti-Fragile that talks about this same thing. So in his book, I think one of his statements is with medicine, with the availability of drugs, we're able to help people live longer, which to me is great. But what he was arguing is all of their comfort has been detrimental to our own health span. So even though we're living longer as a whole, our health spans have decreased. So the goal is to, yes, live longer is good, but can we live longer doing the things we want to? And making these lifestyle changes are going to be one of the most impactful things. And again, no matter what age, no matter where you're at, there's always room to make some changes. Is something that's super, super important. All right. And I will keep going, but if you guys have questions, pop them. And actually, I'll take a check to see if there's questions. Okay, cool. No question. Awesome. So the next thing I wanted to touch on, since we touched on the big three, and again, each person's different. So if you have questions on, hey, I don't like to eat this food, what might be a good alternative, always feel free to stop in and talk to me. Or you might have tried the different aspects I talked about for improving sleep. You might have tried getting sunlight exposure in the morning, decreasing blue light, doing some mindful practice, and taking some melatonin. You're still having troubles, come in and talk to me. And again, there are things that we need to refer to a sleep specialist. I've worked with a lot of people who've had sleep issues. We tried lifestyle things and it turned out to be sleep apnea. And the only way to know that is to do a sleep study. So just know, even if we're doing all these right things, there's still sometimes need for a sleep study in this case, or medical intervention. So if you're not sure, don't give up. There's other ways that we can attack these things. I do want to talk about something that comes up a lot in the pharmacy. Is someone will bring in a newspaper article with a headline in 2020 because we saw science happening real time with COVID-19, that this came up over and over again. So there's a lot of conflicting headlines. One of them that a lot of my patients had brought into me, and this was in March, was the conflicting headlines on certain blood pressure medications and their risk for COVID-19. So if we look at these two headlines, I think they're pretty close to the same day. In Science News, patients who take ACE inhibitors and ARBs may be at an increased risk of severe COVID-19. And then about a week later, I think it might have even been the same day, it says the exact opposite. Evidence suggests that ACE inhibitors and angiotensin receptor blockers may improve prognosis in COVID-19. So just know when you see a headline, a lot of these, even these scientific journals, are just pulling one thing from the trial, and sometimes it's a theoretical mechanism to. The most important thing I say is don't make any changes to your medications or your supplements without talking to your healthcare team. But I do want to talk about, for this one, kind of why this is and why some of these headlines come up sometimes that seem like the headline makes it seem like it's set in stone. Like I think there's one in the New York Times, everybody should be taking zinc for COVID-19. It's like, and they were just taking one thing from one study. And yes, zinc is important, but like we talked about, a lot of people, some people can get it from food. So some people don't need to take a high dose of zinc, other people do. So any of these headlines that say everybody should do X, there's usually some nuance under there. And with the ACE inhibitors and ARBs, some of the theories in the beginning are just outright wrong. So if we look at what the American Heart Association says, American College of Cardiology says, these blood pressure medications, ACE inhibitors and ARBs, there are no data to suggest a link between these with worse COVID-19 outcomes. There's actually some data to suggest they might improve COVID-19 outcomes, which I'll talk about. But this is just to realize is COVID-19 is not going to be the last hot health item in the news. There's going to be a lot of other ones, and you're going to see some headlines. But before making any changes to your medication regimen, make sure that you talk with your healthcare team, because I have seen situations where patients stopped things because they saw a headline and it was very detrimental to their health. So just know if you see a headline, always bring it in. I'm happy to take a look and discuss. So if you're on one of these medications, don't stop it. Losartan, candesartan, captopril, lisinopril, ramipril. There's trials going on right now to determine if these might be helpful or harmful. And I'll show you why they are probably helpful. But if you don't have hypertension, I'm not telling you to go on these medications, but if you have hypertension, these might, added benefit of these is they might help to improve immune system as well. Vitamin D was another thing that came up early, where they thought vitamin D might increase the risk of COVID-19 because it increased the amount of ACE2 in the lungs. And there's a rat study where it increased ACE2 in the lungs. And for those of you guys who are following COVID-19, ACE2 is where the virus binds to. So we look at the spike proteins, they bind to ACE2, that's how it gets in the cell. So the theory was, if we're increasing vitamin D, we're increasing ACE2 expression, we're going to increase the amount of viral load in the cell. And in theory, it makes sense, but what they didn't realize right away is vitamin D is doing so many other things, and ACE2 as well is doing so many other things, that the benefits of increasing ACE2 and the benefits of having a good vitamin D level far, far outweigh the potential downsides of getting a little bit more virus into the cell. So I'll just talk about that story briefly, and I apologize if you guys, this is going a little bit in the weeds here, but I just want to show you guys that there's a lot of nuance between things. So if you look at the renin-angiotensin system, ACE2, yes, it can increase viral load, but ACE2 also improves vasodilation, acts as an antioxidant, acts as an anti-inflammatory, and it's something that mechanistically it makes sense that it would be helpful for COVID-19. So this is why we finally see, and I finally see doctors talking about vitamin D, not only for bone health, but for immune health, because there's been so much data that people who are sufficient in vitamin D and have a good vitamin D level do better than those who don't. So a easy thing to do, and this may be my headline that everybody should do, and again, I told you not to listen to these, but is everybody should probably be taking a vitamin D supplement. And even better than that is to know your vitamin D level, because each person absorbs and uses vitamin D so so differently. I'll talk about a few studies here. So in 2020 and even before 2020, there's been a lot of data on vitamin D in the immune system. And I don't want to harp on these too long because I want to save time for questions. So I just want to just show you guys, there's a lot of different studies showing vitamin D, and these are looking at blood levels. So again, it's not that you need to take a specific dose of vitamin D, it's get your blood level measured, and then we can see what dose is right for you. I know Dr. Anthony Fauci is a big name right now. He takes 6,000 IUs of vitamin D. That's well above what the Institute of Medicine would say, but he knows his blood level. As we get older, we absorb vitamin D less. So a lot of the recommendations I see for vitamin D of 400 IUs to 1,000 are much lower than people usually need. So taking some vitamin D is good. And yes, we don't want to go too high, but a lot of times we need more than that standard 1,000 IUs of vitamin D to hit that area. And I just want to bring vitamin D up over and over again because other than the social distancing, the mask, the vaccines, vitamin D is well below those, but it's something that's very cheap to do and something that can impact our health in multiple ways. So we look at the amount of people who are deficient. If we're not supplementing, 70% of Caucasian Americans have blood levels below 30 nanograms per milliliter. 90 to 95% of African Americans have blood levels below 30 nanograms per milliliter. And this is something that that we want to make sure that African Americans are getting enough vitamin D, and it's not because of anything that's going on. Just when I go outside in the sun, I have a lighter skin tone. Our bodies are able to make more vitamin D than someone with a darker skin tone. So it's something that there is a lot of deficiency, and something that I just want to make perfectly clear that everybody should probably know their vitamin D level and making sure that you're getting enough. If you don't know your vitamin D level from a general standpoint, about 2,500 IUs of vitamin D3 per day is probably going to get you into that spot. I wouldn't go more than 5,000 a day without knowing your level. It's something, if we go past that without knowing your level, there is a risk of going too high. So no, more is not always better, but vitamin D is super important. There's another vitamin D belt, and one thing I like to point out is a lot of people are now knowing about vitamin D3 and the importance of vitamin D, but an important nutrient to go along with it is vitamin K2. So whenever I recommend a vitamin D3 supplement, unless they're on specific medications, I always recommend vitamin K2 to go along with it. And vitamin K2 is something that helps to make sure that, specifically for COVID-19, that clotting is going on appropriately. So you guys have heard about the issues with clots with COVID-19, and if we're deficient in vitamin K and vitamin K2, that can be an issue. So vitamin K is very safe to take. So everyone should take vitamin K2 with their vitamin D3 unless you're on certain medications. And again, just like if you're on warfarin or Coumadin, and if you guys don't, this is a blood thinner, the doctor will tell you and the pharmacist will tell you need to be consistent with your green leafy vegetables. So green leafy vegetables are good for you, but if you eat a lot of those and other vitamin K containing foods, it can throw off the warfarin levels. So a supplement is no different. So before starting vitamin D3 with K2, make sure that you talk to your healthcare team, but it's something that vitamin D3 with K2 is the main way to go. And statins deplete K2, so it's something if you're on a statin, and another reason to take vitamin K2. But I apologize for getting very specific on D3 and K2. And these aren't the only nutrients we look at and recommend. There's a lot of other nutrients depending on certain lifestyle factors that I will recommend for people, but there's just so much data around vitamin D3, and the synergy between vitamin D3 and K2 is important. So taking them together is something that's super important. All right. Yes.
I do have one question.
Okay, I think it was a question.
Talk about mitochondria, what it is for.
Cool. So the question was to talk about mitochondria, what it is, and the purpose of aging. So I will go back to that. It's a good question, and I will talk about that briefly. So this slide shows a picture of the mitochondria. So we can think of the mitochondria as the powerhouses of the cell. So the mitochondria are what produce ATP. And as we get older, our mitochondria become less efficient. So what we really want to do is making sure there's this process called apoptosis, where cells that should be killed kind of just stick around. And by exercising, we can kill those cells, which is a good thing, and rejuvenate new mitochondria. So basically, when we talk about mitochondria, we talk about the powerhouse of the cell or the battery of the cell. So by me lifting my arms up right now, my mitochondria are making ATP. And as we get older, the efficiency of the mitochondria decreases, and also the density of mitochondria per cell decreases. So the best way to increase mitochondria density is to improve what's called VO2 max, and that's your ability to use oxygen, so your ability to walk. So if today you walked 2 blocks and you got a little winded, and then tomorrow you walked 3 blocks and got a little winded, that's showing that your mitochondria health is improving. So there's a direct correlation between your aerobic capacity and mitochondria. So that's why having physical activity, using physical movement is going to be very important for helping your mitochondria to be the most efficient and to put out the most power as possible. So as we age, the efficiency decreases. We want to make sure, so there's our chronological age, and then there's our biological age. So by stressing our body a little bit, that helps our mitochondria. There are certain nutrients and supplements that do help the mitochondria as well, but they're the powerhouse of the cell, and we want to make sure that we are feeding them what they need and giving them the stress they need. Does that answer that? I think. Okay, cool. Good question. So let's go on here. All right, so let's get past me going on and on about vitamin D. Sorry. It's so important. All right, there we go. So I do want to make a note too. There was headlines at the beginning. I think it was the French Prime Minister that had said, don't take Advil and Aleve and NSAIDs if you have COVID-19, because there's observational data in France that, NSAIDs and otherwise healthy people with confirmed COVID-19 were more likely to develop severe illness. This has been since to be found unfounded. What they found was people who take more Aleve and ibuprofen things have more underlying conditions. So there's a sampling bias. So it wasn't that these things were doing anything directly to make outcomes worse for COVID-19. It was just people who take these have other underlying inflammation going. My bias is always to look at other tools besides NSAIDs for decreasing inflammation, because NSAIDs have a lot of other risks. So I'm sure a lot of you guys have been told not to take them because of the GI risks, the kidney risk, and even with the cardiovascular risk. So NSAIDs are tools, but there's other ways to decrease inflammation in the body, and that's where we really work with omega-3s, we work with vitamin D, we work with other foundational things before going to NSAIDs. But just know that things like Aleve and Advil are still okay to take if you need them when you're having pain, if your doctor is okay with that. But there are better options to decrease inflammation, in my opinion. I do want to talk about, so we talk about inflammation and why that's important for COVID-19. So the two kind of things that we can change is our body's ability to respond to an infection, so to properly respond to it, and then our baseline inflammation level. So basically, when we look at this graph here, the risk of fatality from any challenge we face, whether it's COVID-19 or anything else, is partly determined by our baseline inflammation status. So if we're not obese, if our blood sugar is managed, if our hypertension's, if our blood pressure is managed, if our blood lipids are managed, that's going to have a lower baseline inflammation. So we want to do everything we can to decrease inflammation. This is going to go back to some of the things we talked about with lifestyle, but something that's getting brought up a lot is baseline inflammation. Just kind of want to tell you guys what that means and what ways you can do to decrease baseline inflammation and the difference between acute and chronic inflammation. So when we look at decreasing baseline inflammation, we want to first address physiological dysfunction. So when we talk about physiological dysfunction, that's things like high blood pressure. So that's putting a lot of stress on. That's obesity. So more fat mass increases these inflammatory cytokines and increases the inflammation. And then we want to identify and address deficiencies in key nutrients that are essential to healthy, robust immune system activation. So this is where we talked about vitamin D, we talked about zinc, and mainly getting them from foods first. But just know, to improve our immune system, we really need to manage our inflammation. So if you have hypertension, you have diabetes, you have COPD, autoimmune, whatever dysfunction there is, making sure that you're working with your pharmacist and your doctor to manage it. So medications in these circumstances are great tools because they bring down that baseline inflammation. But what we ultimately want to do is treat the root cause with lifestyle. And I saw this in the beginning of 2020 when this first started. A lot of people were becoming non-adherent to their medications, and we saw a lot of issues with that. So making sure that no matter what's going on, one of the most important things you can do is to making sure that you're doing what you can to decrease your baseline inflammation and manage these symptoms. And yes, the goal is to decrease medications and improve lifestyle, but we don't just want to stop them. And the things we can do right now that increase baseline inflammation, and we talked about this for the immune system: sleep loss increases inflammation, micronutrient deficiency, and not moving. And other things are kind of secondary to this. So if you smoke, quitting smoking is one of the most impactful things you can do. Overconsumption of alcohol, so 1 or 2 drinks a night, for most people is probably okay, but over that, it's going to increase inflammation, obesity, and chronic stress. So what specifically can you do from that from a nutrition standpoint? So again, we go back to this. I apologize for keep bringing these things up, but you have more whole foods in our diet and not French fries and ketchup. And cut back on processed foods. So again, something that my great grandma would recognize as food is going to be a whole food. And then aim for an omega-3 index above 8. So this is a test that we do in omega-3s. There's been some recent papers and studies out that they're not as helpful as we thought for cardiovascular disease, but they still are very helpful for decreasing inflammation, for eye health, and a lot of other things with the immune system. So eating our sardine, mackerel, anchovy, salmon, and herring all have great omega-3 content in them. And there's a blood test we have at the pharmacy called the omega-3 index to see where your levels are at. Then we can look if you need a supplement. And vitamin D, not only for other parts of the immune system, it's necessary for decreasing inflammation as well. And then we can look at adding specifically anti-inflammatory compounds like curcumin and CBD. And I like to use these before jumping to the ibuprofen and Advil, and because those things are things you shouldn't be taking every day, and ibuprofen and Advil have a lot of risks associated with them. But you see this again, vitamin D and inflammation, bring it up again. So it is 11 o'clock. I just want to make a couple more quick points, and I appreciate you guys for bearing with me doing this presentation. I know I've kind of spend too much time on a few components, but I do want to make this clear. When I recommend dietary supplements, why a lot of doctors don't like to recommend them is they're not sure what's in them. So dietary supplements are regulated different than drugs. So when you're buying a dietary supplement, making sure you buy it from a company in a line that you know and trust. So we don't carry any value brand dietary supplements. My pharmacy, you'll notice ours are higher cost in most places. The reason is the testing they go through is going to be the same as the pharmaceuticals in our pharmacy. But a lot of the dietary supplements over the counter, why they don't work isn't because the nutrient isn't important. It's because that nutrient you're getting probably isn't absorbed like this product here with this magnesium oxide. So just know for dietary supplements, making sure that you're not buying a cheap dietary supplement. And if you're on the last presentation, we brought this up with the CBD. CBD is one of the worst offenders for this. There's a lot of CBD products out there that don't have anything what they say they have in it, and other dietary supplements are no different. So dietary supplements are great tools, but unfortunately there's one other hurdle that we need to get over, and that's making sure you're getting a product you know exactly what's in it. For over-the-counter products is different. So if you're buying Advil or ibuprofen, I'm always going to recommend the ibuprofen because you're basically paying for the Advil name, and they're regulated in such a way that it doesn't matter, but dietary supplements, it does. And one other point I want to make is there's some herbals that we'll use for certain situations when people are getting sick, but just know a lot of the most popular ones, it's actually this airborne gummy, they have certain things in there that can be helpful. So like echinacea is it something that can be helpful for the immune system. Ginger is helpful, but they have it in doses where it's really not doing anything. So with this airborne original, you're basically just paying for an expensive fruit snack. So I would rather someone just get some fruit snacks. When we look at the first ingredient of their proprietary blend, it's maltodextrin. So just know that when you're picking something, if you're going to buy something to support the immune system, not that there's probably anything bad with this, but it's not doing you much good that you think it is. So so there's a lot of advertising with dietary supplements as well, and these can be helpful ingredients. But if you look at like the echinacea, there's 35 milligrams of this proprietary blend. So there's probably a milligram of echinacea in there, maybe. If you look at a product that actually has something that it can be helpful for the immune system in certain situations, there's 100 milligrams. So it's 100 times as much in this product. So just know, just because a product has certain ingredients that your friend or someone says is helpful for the immune system, if it's a proprietary blend, I wouldn't take it. And looking for things that are listed specifically the dose. So as a clinician, I want to know if I'm giving somebody N-acetylcysteine or elderberry, what dose I'm giving them. I don't want to have to guess. So there are specific immune products, and some can be helpful in certain circumstances, but just take a look at the label to see what's actually in there. And yes, elderberry is something that can be very helpful, particularly for influenza. Not much of that going around this year, but it's something I do recommend to my patients when they're starting to get sick, is some of these herbs with N-acetylcysteine. All right, so then the last question I get, and why I didn't want to spend too much time on any of these specific ones, is because there's a place in therapy for a lot of these. It's just there's a lot of variables. So the question that I usually get is, so what dietary supplements should I take specifically for immune system? I think you guys are going to know the answer to this is it depends. So discuss with an open-minded doctor of pharmacy. So dietary supplements, just like drugs, are not good or bad. It's just each person has different needs, because your neighbor might be on 10 prescription medications, you may be on 2. Doesn't mean that you should take the 8 that your neighbor takes. The dietary supplements are the same. There are some that come up over and over, and things that I have been recommending quite frequently, and they're the things we're usually missing from our diet. So easy weight, high quality multivitamin from a professional company, vitamin D3 with K2 if you're not on warfarin. If you're on warfarin, just vitamin D3. N-acetylcysteine, I didn't talk about that much, but N-acetylcysteine is one that has been very impactful for improving glutathione production. So that's the master antioxidant. It's also something we use in the pharmacy quite frequently as a more natural Mucinex replacement. So if you guys are getting lung congestion and are having trouble breathing, N-acetylcysteine is a great tool. I recommend a lot to my COPD, asthma patients, or anybody who's getting sick. It can help to thin the mucus much better than Mucinex. And then EPA and DHA, most people are not getting enough of that smash fish and magnesium. And then there's these other things as well. And again, each person is different. And there's a lot of other things on this list that I take as well, but it doesn't mean that you need to take them. But I'm always happy to go through things with you guys to discuss on which things might be helpful for you. In general, what you guys can all do to improve our immune systems is number one, physical distancing and masks. So I didn't spend too much time on this because it's something that's being talked about a lot. But yes, those two things are important. Number two, get your COVID-19 vaccination. And right now, it doesn't matter which one, whichever one's available to you and when you're eligible, get your COVID-19 vaccination. Number three is the pandemic support protocol. So we have at the pharmacy a list of different nutrients that we recommend people take to help support their immune system. But again, don't start or stop any medication or supplements without talking to your pharmacist. Connect virtually with a loved one. We're doing that right now, right? So that's good. So having that social connection is really important. Getting some sunshine. Unfortunately, right now, the sun's at such an angle in the winter that we're not getting the benefits of the vitamin D. But when we talk about setting circadian rhythm, and there's so many more benefits from sunlight than just vitamin D, getting out there is important. But, we all have coats, jackets on. So right now, really important to take a vitamin D supplement. Decrease blue light exposure at bedtime. Talked about that ad nauseum. Increase movement. So no matter where you're at, increase movement. Don't overdo it, but increase movement and work with a professional there if you're unsure on what movement is safe for you. And then take some time for yourself. And one of my colleagues, she always, I love it, she says, eat a vegetable. So if you're eating 5 vegetables today, eat 6 vegetables tomorrow. If you're eating 0, start with 1. So wherever you're at, there's ways to improve. And these are all things that are improve our innate immune system. With that, I will leave it for questions right now. So if there is any questions, I'll do that. I'll try. I'm going to try to read them. Let's see if we can get one. Oh, all right. Question. Actually, can you read them? Can you see me?
Yeah.
Okay.
I see my doctor every 6 months, annual checkup and in between. There is a blood draw each time and never levels of vitamins such as D noted. Is this due to insurance dictating? How do we get these things measured? There are markers for protein levels as well to determine immune status. These are not done automatically as well. Adequate protein intake of the right kind is of great importance as well as all the other very good things you stressed. Thanks so much for this excellent presentation.
Can they hear you?
I don't know.
Okay. I think I have it up, so I'll repeat that just in case. So thanks. Julie was getting me the questions, but I can see them now. So there's a lot of pieces to this question. So I'm going to say the question now and piece it apart. I'm glad I was able to pull this up. But so the question is, I see my doctor every 6 months, annual checkup and in between. There is a blood draw each time, never levels of vitamins such as vitamin D noted. Is this due to insurance dictating, and how do we get these things measured? So I'm going to start with that question first. So it's usually the doctor's preference. So some physicians that I work with in town will test vitamin D on almost all of their patients. They have what's called kind of their standard blood draw where they'll have that on there. But a lot of times for these nutrients in particular, the Medicare guidelines and other guidelines are such that they're not included in there. So you need to explicitly ask for them. And if your insurance doesn't cover it, which sometimes vitamin D levels and other things aren't covered, if you're getting a blood draw, they're very, very cheap. I work with my physician here in town, and a couple of my things weren't covered on their blood draw. I think to add on a vitamin D was like $10 or $15. So it's something that the doctors are really focused in on what is going on right now, and they do a great job of that. Of, hey, is there any fire that's happening now? But what we do a poor job of, and the doctors have a lot to focus on, so this isn't saying they're doing anything wrong, is that unless they explicitly know you want your vitamin D level measured or you want your iron or ferritin measured, they might not add that on there. So each doctor is different, but it's what I always tell people to do is to ask. So particularly for the nutrients of note at your doctor's office, I always like to get a vitamin D. I always like to get iron markers. I always like to get, and sometimes vitamin B12 doesn't tell you much, but those two for sure are very important. And if your doctor doesn't want to do them, they are available at the pharmacy. We have kits. The kits that we have are $50 since we're only taking that one measurement to get it. So that is a way to get it. But my goal is always to, how can we have the most cost-effective way to get these measurements, and getting it on your normal blood draw through the doctor is the way to go. But if not, we've got these things in the pharmacy that you can use as well. And yes, sometimes it is what insurance dictates, but these are things that you could call your insurance company and ask. But most of these nutrient levels are going to be not very expensive if you're already getting a blood draw. And then, so the next part of the question is, there are markers for protein levels as well to determine immune status? Yes. Yes, there are. And then they're not done automatically as well. Yep. Adequate protein intake of the right kind is of great importance, as well as all the other very good things you've stressed. Thanks so much for this excellent presentation. Yeah, so that's a good point, is there are other blood markers that we can look at. And a lot of these blood markers are only taken when they're looking at like specific cancer diagnosis. And for some of them, how helpful some of these blood markers are is hard to say for certain circumstances, just because we likely can see some symptoms before those blood markers occur. So it's kind of measuring chaos in some states. That's sometimes why doctors don't measure those specific proteins looking at immune functions, but it's something interesting to look at. But those, if you have to pay for, are going to be more expensive. There are some wellness clinics that will do these immune panels, and some of them are helpful, but just know some of them are very expensive, and not that it's going to cause harm, but it's something that you might be paying $500-$600 for these quote unquote immune panels. And it usually, when I've had patients get it done, doesn't tell you all that much, but it is, if your doctor can do it, it's a good thing. But I'd try not to get it from somewhere where insurance isn't paying for it. And I do appreciate you mentioning the adequate protein. You definitely should have mentioned that in the presentation. That's I think this person must be a dietitian. You guys, it's spot on. But when we look at people's foods that they eat from the macronutrient perspective, a lot of people are getting fats and carbohydrates. These are our comfort foods, you know, pizza, things that we're all ordering right now that are takeout. But what they're usually deficient in is protein. So if you're not over consuming calories, the macronutrient most people need to focus on is protein. So that's where we do sell, you know, protein powders and replacements. But the best thing is to focus on food first. So as we get older too, a lot of people don't eat as much proteins. These are things, lean meats, that we can eat. And there's places where you can get them from vegetables with different beans and different products like that. But protein deficiency is, for a macronutrient, is the thing that almost everybody should focus on. So protein and fiber are two things I don't think I mentioned, and I should bring up. So prioritizing protein, having some protein at each meal is super important. So awesome questions. I hope I answered those. And then next question was, fish oil was recommended for a long time. Does it help anyone except the people that sell it? That's a good question. I like it. So short answer is yes. And if you look at some of the research from University of Minnesota, Dr. Bill Harris, they look at more than just the cardiovascular system. So it is still, so there, I guess, a couple things here. So fish oil, the EPA and DHA, we sell it in the pharmacy as a dietary supplement. We also sell it, there's approved prescription products. Lovaza is one, and dang it, I can't think, but there's prescription products specifically for hypertriglyceridemia. So if you take 4 grams of EPA and DHA, and the important thing about fish oil is why a lot of the studies just show it doesn't matter, is most fish oil products have 1 gram of fish oil and basically no EPA and DHA. So the EPA and DHA are the 2 omega-3 fatty acids that actually make a difference. So in the pharmacy, we use it quite frequently for decreasing triglycerides and helping with cholesterol profiles. And so there is good data to support that, and drug companies have done the studies on that, for better or worse. That's where the studies was. And it doesn't help anyone except the people that sell it. I like that. So a lot of the fish oil products that are being sold are just straight junk. And my bias is when I look at the studies on fish oil, looking at more than just the cardiovascular function. So if we look at for eye health, I work with a lot of optometrists. They recommend it quite frequently for dry eye. It's something that's recommended for decreasing inflammation. But should you go to fish oil first? No. But what we should do first is, are you eating sardines? Are you eating mackerel? Are you eating anchovy? Are you eating salmon? Are you eating herring? And most people aren't. And the reason a lot of the studies show fish oil isn't effective is they try to study it like a drug. So if we have, say, amlodipine as a drug, everybody has a baseline of 0 of the drug. So when you add in the drug, you add in 100 or 10 milligrams of amlodipine or placebo, you're comparing 10 milligrams to 0. The problem with looking at nutrients like drugs is in the studies that a lot of them that had no benefit to omega-3 fatty acid supplementation, they didn't do a baseline status. So a lot of people in the trials, there's no way to know where they're at. So adding, a gram of fish oil is like just basically like giving them nothing, because they're not really changing anything. So it's something that my bias is it's still helpful, still take, but again, not everybody needs to take fish oil. If you have these specific conditions, it's helpful, and if you're not eating fish with it, it's helpful. But there are a lot of studies that have shown that fish oil is not helpful for specific disease states when looking at it like a drug. So that's a good point. There's a lot of, so I should say there's a lot of people promoting fish oil in ways that's not true, that because it's not that helpful. And there's a question of, what do you think of the online source called consumerlab.com? I subscribe once a year and find it very informing. Yeah, consumerlab.com is a good source for finding, because they'll pull products off the shelf and test the products. The one problem with it is it's kind of a pay to play. So a lot of the products on there, the companies pay Consumer Lab to test them. But if they're pulling them off the shelf like they say they are, not being sent bottles, it's a good, there's good information on there. So yeah, consumerlab.com is a good source for information. Next question: can you direct us to further literature in the vein of Hometown Pharmacy's mission? I've read alternative from mainstream authors such as Robert Sapolsky and Joel Wallach, but thought that maybe you'd have a favorite researcher you'd like to point to. Oh, that is an awesome question. Sapolsky is probably my favorite researcher. My passion and my bias is looking at muscle mass. So muscle mass is something from a standpoint of pharmacy and other places that it's a metabolic tissue that acts as a sink. It increases mitochondria. So my favorite author right now is Dr. Stu Phillips. So Dr. Stu Phillips' labs looks at exercise a lot and looking at muscle and how it impacts different various health aspects. And from alternative mainstream things, some of my favorite from like a nutrient standpoint is Dr. Bruce Ames. He does research for somewhere, I forget, in California, but he developed a theory called the triage theory, which basically states that there's micronutrients right now that our bodies can use to make sure, you know, use vitamin C to prevent scurvy, vitamin D for rickets, or I think I said those backwards. But anyway, there's things that vitamins that our body will use to prevent these deficiencies, diseases right now. But if we're not hitting these other levels in them, so like vitamin D, we all know vitamin D, and your doctor knows, is important for bone health. But you need such a low level of vitamin D for bone health that your body's going to prioritize that for the bone first. Then the next level would be using that for other things like immune function, using that thing for things like converting tryptophan to serotonin to brain health. So so Dr. Bruce Ames and Dr. Stu Phillips are the two people that I'm following the closest right now. And yeah, Hometown's mission right now is really changing our practice and changing our pharmacy. And I think you guys saw we're doing in-body scans as a body composition scans. We're doing different vitamin D testing and different wellness consultations, and I'll put that up in the bottom, because it's not that traditional medicine is wrong, and it's not that alternative medicine is right. It's that there's room for both. We need to be using tools from both worlds. But that is an awesome question. Yes, right now it's Stu Phillips and Bruce Ames. Next question is Elderberry Preventative. So in the studies that when you look at elderberry being effective, so there's a lot of studies, kind of like fish oil, where elderberry is not effective, and there's some studies where it is effective. In the studies where it's effective, they're specifically looking at influenza, and we're looking at that time right before, right after exposure. So it could be a preventative in the case of I'm not flying right now, but how I use elderberries if I'm flying or going into areas that have a lot of not just COVID-19, but influenza, other viruses around, I'll take a product called Viracid, or this other immune product that has some elderberry, has some zinc, it has some echinacea. So these are things that help to prime the immune system. So I'm not taking it all year round, but I'm taking it before a possible exposure. But the most data for elderberry is for shortening like a cold duration, kind of like you guys are familiar with Tamiflu, which is the drug that we use, but it works the best if you catch it right away. So if I have a virus right now and it's starting to replicate, and then I wait like a normal guy does for a week or two, and then I take it, that's not going to work quite as well. Where it works the best is taking it right away, where things are at. And again, like fish oil, there's a lot of studies out there where it wasn't effective. Where it seems to be most effective is decreasing the duration and severity of influenza. So starting it as soon as that you have symptoms is important. There's also a potential risk of why I don't recommend everyone takes high doses of elderberry all the time, because it's stimulating the immune system. If someone has an autoimmune condition, it might potentially make that autoimmune condition worse. It's probably using very high doses and unlikely, but it's not necessary to take elderberry all the time unless you're going into environments that there's a high risk of getting sick, or when you start to feel sick. Question, is there any supplements for GERD that would take the place of a prescription? That's a really good question. So there are, but it depends. So the GERD is gastroesophageal reflux disease. So basically, we think of GERD as, I don't know if you guys can see, but let's see. Okay. So we have, so I'll put my sphincter up here. So in the stomach, there's this sphincter that closes. And if it doesn't close tightly enough, or if it relaxes a little bit, or if we have overproduction of acid, you get acid coming back up. That can cause issues. There's different causes for GERD. So yes, there are supplements that I've used for people that have helped. So one of the supplements that I've used for people is apple cider vinegar, but this can make things worse as well. So apple cider vinegar is an acid. For some people, GERD is actually caused by hypochloria, which means not enough stomach acid. So I give them apple cider vinegar, betaine, and pepsin as a trial before they eat. And that will help to improve digestion, to improve motility, which can help for GERD and help for nutrient absorption. But if you feel like it makes things worse, then we need to look at it, because it actually can make things worse. Because if the issue with GERD is you're producing too much acid, then it's going to make things worse. But a good test is to use apple cider vinegar, or there's a product called betaine and pepsin, and use it with your first bite of food, and that helps. The other thing for GERD, it depends on the time of day, and I could probably spend like 30 minutes on this question, but just but the other big thing, and it's kind of, people don't think about this, is if we have GERD at night when we're laying down, it's usually a gravity issue, but melatonin, taking melatonin can be very helpful for tightening that sphincter. So if you have GERD at night when you're laying down, melatonin is a place to start. If you have GERD, like that reflex right after you eat, using something like apple cider vinegar and using something like betaine and pepsin might be helpful. But again, that can make things worse. So making sure you're working with the pharmacist. And if you do take a proton pump inhibitor right now, it's something that you don't just want to stop. You want to gradually go off of it. But there's long, nuanced protocols. But yes, there are things we can do to help GERD, but it depends on the cause. This question, there are different types of magnesium supplements. Which one do you recommend? That's a really good question. So the just as a overall arching theme is, the only magnesium I don't recommend is magnesium oxide. So magnesium oxide, you can think of it like a rock, so kind of like limestone. So magnesium oxide works well if you want to, if you're constipated. So you can take some magnesium oxide, and magnesium will help to loosen the stool, but the absorption is very, very poor. So when I look at the magnesiums I recommend, it's going to be a chelated magnesium, which means the magnesium is bound to an amino acid. If you look at, so my bias is to use magnesium glycinate, not to say that it's the best, it's just something that's the most cost effective, that you can get a high level of magnesium bound to a glycine, which is an amino acid molecule, and the absorption is good. And most people, like we talked about protein, aren't getting enough glycine in their diet, so there's another added thing there. So magnesium glycinate is my preference. We compound and make a product that has magnesium glycinate in it. The other ones that are helpful, magnesium citrate can be well absorbed, magnesium malate, and there's some data to suggest that magnesium threonate might be better for, migraines and things, but quite honestly, you're paying more money for it when you look at the absorption. Magnesium dissociates in the GI from the amino acid to get absorbed. So magnesium threonate, magnesium glycinate have basically the same absorption. So you're just paying more money for it. But basically, as long as you're not taking magnesium oxide, you're probably good. All right. Does K2 interfere with aspirin 81 milligrams? That's a good question. So vitamin K only interferes with vitamin K antagonists. So warfarin's mechanism of action is it antagonizes vitamin K, and it works on the matrix GLA protein. But so short answer is no. It's very safe to take vitamin K with aspirin, just like your doctor wouldn't tell you limit the amount of green vegetables and salads you take with aspirin. Taking vitamin K2 to making sure you're sufficient while you're increasing vitamin D3 will not affect the aspirin. It actually, vitamin K, if we're deficient or insufficient in it, it actually can cause dysregulated clotting. So don't think of vitamin K as causing clotting. It just makes sure your body has enough of that micronutrient. So when you need to clot, you'll clot, but when you don't need to clot, you're not going to clot. So it's kind of it's very safe. If you look at the Institute of Medicine, there actually is no recommended tolerable upper intake of vitamin K2 because it's so safe. So the only one is the warfarin, because of how it works, and because if you're on warfarin, your doctor will tell you be consistent with the green leafy vegetables you take because they got vitamin K in it. But aspirin, I recommend it all the time for my patients as an aspirin, and vitamin K2 theoretically will help the aspirin because it will making sure you clot when you should. So it theoretically will prevent, the as much bleeding and bruising. Vitamin C is another one I should bring up with that. If people have like skin where you touch it and you bleed or you bruise or bloody noses, just low dose vitamin C can be a helpful thing for that. How long before you fly or travel should you increase your zinc? I was taking airborne, but now what should I take? Good question. So from a basic standpoint, just to make sure we have enough zinc, I just have people take a professional multivitamin like Alpha Base that has about 10 to 15 milligrams, and that's kind of on a daily basis. And I don't really have people ramp up their zinc before they travel, but what I do have people do, and where the data for using zinc to prevent viral replication is actually, instead of using a zinc capsule, there's zinc lozenges that are these tablets. So when I fly, I take Viracid with me. I take 2 capsules of Viracid, which has some echinacea, elderberry, vitamin C, and then I'll take a zinc lozenge. And the zinc lozenge, because you're coating the mouth with zinc, theoretically, and there's some data to show this too, that if a virus were to land in your mouth, there would be less replications, but you don't really need to load with zinc. And I should also mention too, it's important. A lot of people hear, zinc, and then the some of these articles that are coming out that's important for the immune system. If you take these really high doses of zinc, it actually can deplete copper. So you want to make sure that we're not taking high doses of zinc. So unless there's a clinical, situation where you should be taking high dose, I wouldn't take more than, say, 30 milligrams a day, because you can deplete copper by taking too much zinc. But what I do with, and there's no right or wrong for this. My wife, she'll take start using the zinc lozenges and the Viracid, which has some elderberry and things, a couple days before. I usually just do it when I get to the airport. She's a better planner than I am, but I would say the best would be probably 2 to 3 days before, take it. Then when you get on the plane, take it, and then after you land, take it for a couple days. That's like, for me and my wife, the only time we get sick is when we go on an airplane. Haven't been on an airplane for over a year, but yeah. So that's these are very insightful questions. I wish we're all together in a room so we could talk and see each other. But I should mention I am over time now, so let me just can you see my slides? Cool. No? Okay. I should mention, so if you guys want, these, I'm always happy to answer these one-offs, so always feel free to come in, these one-off questions. But if you want a more in-depth consultation, like I said, just like with Gerd, there's a lot of nuance. I do take appointments for doing these wellness consultations, and we will be soon doing a program, Educate, Empower, Evolve. These are more expensive, but like we talked about, there's a lot of metrics that we do, and there's a lot of other things to go along with this, and we're just piloting this now. But it's something that I'm very passionate about, changing the model of our pharmacy from just giving people medications to creating programs. And my goal is to hopefully make these, cost-effective, high-level programs to help people to not need medications. But yes, so thank you everybody for being here. I'd say get outside and enjoy the cold day, but maybe get out there for a minute. But I think those all the questions. All right. Well, thank you guys. I'm sure we'll see each other again, and hopefully I don't have to talk into my screen next time.